Subcommittee. As co-chair of the Health and Welfare Subcommittee of the African American Task Force, and in accordance with passage of House Concurrent Resolution 85, adopting rules of procedure for conducting virtual meetings of the General Assembly and its legislative committees during an emergency, this public body is authorized to meet virtually. Please note that there is no physical location to observe and listen contemporaneously to this meeting, which was authorized pursuant to HCR 85. We are utilizing Zoom webinar for this virtual meeting. All members of the Health and Welfare Subcommittee have the ability to communicate contemporaneously during this meeting through this platform, and the public has access to contemporaneously listen and participate in this meeting by registering via the meeting link that is posted on the General Assembly's website. The public has access to watch and listen to this meeting through a live stream available on YouTube. A link to this live stream can be located on the General Assembly's website or by searching for the Delaware General Assembly YouTube channel. Should any subcommittee member experience technical difficulties during this meeting, please call 302-415-4433. Public comment is permitted at the close of this meeting. Public attendees in the Zoom webinar must utilize the raised hand function to be permitted to speak and shall be called on in the order in which their hands were raised. Members of the public will be unmuted and informed that they've been allotted 2 minutes to speak. Public comments can also be submitted in advance of and up to 24 hours after this meeting by emailing africanamericantaskforce@delaware.gov. In the event that the public is unable to access the meeting will be adjourned and rescheduled. Please note that any votes that may be taken during this meeting shall be done by roll call vote. Let's begin today's meeting by taking a roll call attendance of the subcommittee members present. Subcommittee members, please ensure that your cameras remain on for the entirety of the meeting to the best of your ability. When your name is called, please unmute your device and affirm your attendance. Once you've been recorded as present, please mute your device for the duration of the roll call. Representative Melissa Minor Brown is present. Representative Kendra Johnson.
Representative Kendra Johnson is present. Thank you.
Ray Jones Avery. Dr. Carmen Jordan Cox.
Present.
Dr. Eleanor Kiesel. Simone Philpotts. Dr. Debbie Harrington.
Sorry, present.
Thank you. Cassandra Coates Johnson.
Present.
Forrest Watson.
Present.
Keith Hunt.
Present.
Dr. Nikisha Williams Bailey. State Treasurer Colleen Davis. State Auditor Kathy McGinnis. Oh, I'm sorry. State Treasurer Colleen Davis is present, marked present. State Auditor Kathy McGinnis and Lucretia Young. All right, with the quorum being present, each subcommittee member's identity has been authenticated by the chair. Let's move towards agenda item number 1, which is acceptance of the meeting minutes from 1/19/22. Everyone has received a copy of the meeting minutes in their email. Can I entertain a motion to accept those minutes?
So moved.
Second.
Carmen Jordan Cox, and seconded by, was that?
Representative Johnson.
Seconded by Representative Johnson. Thank you. And we can move forward with the agenda. All right, so.
1 second, Minor Brown, I'm sorry. Don't we have to do the voice vote and the acceptance of the meeting minutes as well for all members?
Yes, we do. Thank you, Roger.
Listen, we work together. My pleasure. You're doing all the work right now. I get to just.
Oh, no, I was about to pass it to you before you so politely did. I'm still going to on that next slide. All right, so we do have to do a roll call vote to accept the meeting minutes from January 19th, 2022. Representative Minor Brown, yes. Representative Kendra Johnson.
Yes.
Ray Jones Avery. Dr. Carmen Jordan Cox.
Yes.
Dr. Eleanor Kiesel. Simone Philpotts. Dr. Debbie Harrington.
Yes.
Cassandra Coates Johnson,
I need to abstain. I was only able to attend like the first 10 minutes of that meeting.
thank you. Forrest Watson,
Yes.
Keith Hunt,
Yes.
Dr. Nikisha Williams Bailey, State Treasurer Colleen Davis,
I'm abstaining. I didn't catch the entire meeting.
State Auditor Kathy McGinnis, and Lucretia Young, who is absent. Thank you. We can move forward with the agenda. And Representative Johnson, if you would like to speak on the next African American Task Force meeting, feel free.
Feel free, huh? Thank you. Thanks, Rep. Minor Brown. Didn't realize I had a slide coming up. So as you all can see here, the final full body African American Task Force meeting will be held on April the 11th. What does that mean to us? That means that our work, which we knew was already is in its wrap up phases as it relates to the recommendations. That is why it was so important today that we have a quorum so that for the recommendations that are coming from some of the research groups that we can vote on them and then have them moved forward in enough time to be considered by the full African American Task Force and then ultimately included in the final report. So that means we have today, we're in February, and then we have March. If we have a meeting in April, that meeting would certainly need to be prior to the 11th. Actually, I don't even think that's possible because the expectation is that we send recommendations to the full task force in advance of the meeting and not just kind of show up with them. So that means, guys, we have this meeting and March's meeting to get our house in order and be ready to submit our recommendations to the full body African American Task Force. Questions, comments, concerns? Wow. I don't know how to take that. I've never heard us so quiet before. Okay, well, we'll move on. Up next, presentation of recommendations. So each subgroup that has not presented yet, we are prepared to hear from you today and seeking at least 2 recommendations that we can vote on and move forward to present to the larger full body African American Task Force. And then we have here the subgroups that have already presented to be prepared to discuss your recommendations for the voting process. So, Rep. Minor Brown, how would you like to handle this part? So what we know is that
Rep. Johnson,
mental health.
Let's pull up the next slide and then we'll be able to kind of use that as a guide.
Okay. All right. Okay. Wonderful. Thank you.
You're welcome.
Subgroup recommendations, and I'm moving my stuff all around here. So guys, just kind of deal with me. All right. So physical health recommendations is in progress. Behavioral health recommendations were submitted on January 19th. Black maternal health passed to full body. Training and education recommendations were submitted on September, and food and housing is in progress. So, and looking at this, there is nothing more that we require from the Black maternal health group. And as you see here, the recommendations, I believe there were 2 or 3, Rep. Minor Brown?
Yes, there were 2 recommendations that we voted and moved on to the full body African American.
Right, and they were passed.
And they were passed.
Yes. So there is nothing more that the Black Maternal Health Research Group is required. All other groups, behavioral health groups, we need to have a discussion. Training and education, the same is true. And then physical health and food and housing both indicate that they are in progress, which means we've not seen any recommendations from those groups yet. So, in looking at this, do we have representation? Let's see, we'll start with, okay, training and education. Training and education, you guys submitted recommendations on September the 15th, 21.
Who
Oh,
are,
we did. We had a discussion. We didn't really finalize recommendation. I mean, we can go back. I was looking, I paused because I was looking at the draft recommendations that Caitlin sent out. And I was trying to find where there were recommendations from training and education, but I don't see those. And maybe they're just written differently. I don't know. So, but we talked mostly about how we educate the public on, how you provide health services, health care. And so I would have to go back to look at the exact wording for the recommendations before I can speak intelligently on it.
Okay.
So can I go back? Can you come back to me? I'm going to go back to the exact recommendation and see, because we didn't, when we presented, we did not say, okay, these are the recommendations we're going to go with.
Gotcha. Okay.
So I'm going to go back. If you can come back to me, I'm looking for.
sure.
Understood.
Debbie, if you would like, I have the Google Doc. I can share my screen with your recommendations on it.
Okay. All right.
That would be helpful. Thanks, Rep.
You
Minor
want me
Brown.
to do that now, or would you like me to come back to you?
No, we can do it now. That's
Okay.
fine.
Chelsea, can you make me a host?
Yes.
Okay, let me find it. Give me a second. Okay. All right. Can everybody see my screen?
Yes.
Okay. I'm going to jump down to the recommendations. I have, and then Dr. Harrington, Debbie Harrington, tell me if I'm.
That's exactly the one. Yep. That's
Okay.
it. Yep.
So this is create an education and training partnership in Delaware between Christiana Care and Bay Health hospital systems and nonprofit organizations such as Connections, Sunday Breakfast Mission, so nonprofit organizations that mirrors Wilmington Housing Authority and Cook County Hospital's intervention plan.
Right. Yeah.
So this is kind of broad. I guess we would.
That is broad. It is really broad. Yeah.
Mm-hmm.
So, but I mean, the intent is to really to create some kind of education and training partnership between the hospital and the nonprofit agencies that exist in the communities, that in particular in communities that experience tremendous disparities, and sort of help the hospital system, the providers understand who they are treating, who they are providing care for. And so that is broad, and how we narrow that down to a specific recommendation, I don't know. We have to think through that.
Maybe, if I may, maybe there would be two sentences in this. And the second one to say what the goal of the partnership might be. If we're creating create an education training partnership, and then the second sentence as part of that recommendation would be to state what the objective of that partnership would be. But just a thought, because someone who's reading this who hasn't been part of the discussion would have no idea. So why a partnership with those two groups? What's the point of doing that? So somehow we need to have the recommendation shaped so that anyone who looks at it can make sense out of why.
Makes sense out of it. Yeah. So all right, because so
How it's phrased.
yeah, I agree. So all right, I gotta narrow the wording for that, so that it says, so that somehow we're saying we're creating this partnership so that we for the nonprofit agencies, that they better understand the hospital systems and how they have to operate, and then those that are in the hospital system, that they understand how to provide better care for underrepresented communities. So I you got an idea, Cassandra? Carmen, I'm sorry.
I'm wondering if maybe there should be an introductory sentence, and then the recommendation would be the second sentence.
Mhm.
Have we done that with any of the others? Have an introductory sentence that kind of gives a context? I think we did that with Black maternal health, didn't it? Isn't it kind of a context and then a recommendation?
So I'm looking at the list of recommendations that Caitlin sent out, and there are no, there in all of these recommendations, there are no introductory statement. It just says make behavioral mental health part of a prevention wellness exam.
They all start with verbs.
Yeah, it just says what it is. It's eliminate limitations on the number of mental health visits per year. So pay for prevention exams. Okay. So, all right. So I'm going to have to come back to this one. Can we come back and let me think about the wording?
Let me jump in on this, if I may, Debbie and Carmen. If you can send us just because you're speaking so clearly about it, send us an outline. Us being me and Debbie. And Debbie, I will. If I can get a contact number for you or email, schedule time with you so we can walk through that outline together and assist with that.
Okay, yeah.
Because I have to raise my hand and say I haven't been present, so I'm jumping into the deep end of the pool with you on this. And then my last comment on it is, then because our time is tight, we will use email or Google Docs to give you the rest of the committees something to look at and give feedback on, so that we can shape it up via email before we have the next meeting, if that'll work, Representative Minor-Brown.
Sounds good. So should we continue with the recommendations this evening, or do you want to do that with the rest of the recommendations?
Yeah, I think just for consistency, and I'm speaking only for the educational ones. I'm not sure what the other groups want to do, but for these, if we can come back. So the next one is talking about, cultural competency and ethnic diversity and inclusion. So we can come back. Can we just come back to you with all of them and then we'll be clear on what it is what the recommendations are that we want to present?
Yes. Yes,
okay.
we can. All right. Okay, Chelsea, could you pull up the PowerPoint, please?
Is it showing?
Thank you. We can see it.
Thank you.
So physical health, do we have anyone?
Yep.
Were we not, Rep. Johnson, where did you end? I'm sorry, I don't want to jump ahead.
So I was working with the individuals that we've actually, or the groups that we've actually had some discussion with, and they've presented something to us.
Okay.
So if we're going to continue in that manner, then the next would be the behavioral health recommendations that we just discussed last month.
Okay. Let's see here. Let me pull up behavioral health. Can you all see my screen?
Yes.
Okay. So for behavioral health recommendations, Forrest, these were his recommendations, and they were also emailed to the subcommittee members to take a look at. For now, we want to take two of these recommendations to move forward to present to the African American Task Force at their April meeting. The first bullet was make behavioral and mental health part of prevention wellness exams. So not only is this an excellent recommendation, but this is actually a bill that was just recently drafted this session and it's circulating. So Forrest, you spoke that into existence and
did.
signed on to this legislation. So you will see this legislation this session. So let's move on to the second one. Every school, including elementary and middle school, should have a school-based wellness center, not just for high-need schools. In addition, make the health delivery be a universal screening model versus a medical access model. So the first sentence, every school, including elementary and middle, should have a school-based wellness center, not just for high-need schools. But the second sentence, make the health delivery be a universal screening model versus a medical access model. Forrest, could you explain what that is or what that means?
Yeah, this is, first I'd like to say, the Department of Education is now releasing a thrust to include universal screening as a foundation to assess at least trauma and trauma-informed practices in our school. And what they have found, and I agree, is that some models that are not universal wait for symptoms or behavior to be the essence of intervention. And what that does is, it's like, if the thing that we know about COVID-19 now that is in the minds of many of us because of at least our experience with this pandemic, is that people can have COVID and not express symptoms. People can have COVID and not express symptoms. So you can be a carrier of COVID and not express symptoms. What that means is that COVID is operating in you for different things in terms of, one of which is the transmission of it. But if we look at the medical access model, and we're moving towards this anyway in the medical field. We're moving away from symptomatic issues relative to when we have some intervention, because we know now that symptoms does not always indicate whether a person is sick or grappling with or are challenged with any kind of malady, disease. It's better to do a universal screening to determine what a person has or what level of baseline could be given. And so, if we're talking about universal screenings, there's also the CDC released a report commissioned by or requested by City Councilwoman Hanifa Shabazz. And one of the things that came out of that CDC report about Wilmington in a state of violence is that if we could do early intervention and prevention, we could sort of get upscreen on some of the violence that is more critically affecting our communities, because there are some things that we could, through our screening process, that we could provide. First of all, we can identify and we can provide some remediation or some support to change the trajectories of some of the early intervention students and or children who may be on that trajectory where they would pick up a gun and shoot someone. So what early intervention, what universal screening does is helps us to capture individuals who may be grappling with or struggling with issues, but don't demonstrate a behavior or a symptom that causes a person or someone to pay attention. One more fact, in the school system, in the colonial school system, yeah, I think this was a report they released probably a couple years ago. They found that as they reviewed suicide and suicide ideations in their district, 50% of those suicide attempts or ideations came from students who had, quote unquote, no discernible behavior issue. So what that says is that if we look for, quote unquote, a symptom or behavior deviation as the means for intervention, we're missing at least 50% of those individuals who would be exposed to suicide or commit suicide. It's not to rule out, though. Here's what I'm saying. It doesn't rule out where we do find a person who has exhibited these kinds of issues. Of course, intervention should be given, but this is more of a universal screening effort. And I don't know, did that make any sense to anybody?
That makes a lot of sense. So ensuring that every elementary and middle school in our state has a school-based wellness center that provides a universal screening model when it comes to behavioral health.
Yeah.
Okay. Are there any?
And I would also say, and I know you're talking about physical health as well, and I think we at Life Health you have the baseline for all of it. I don't think you just limit it to behavioral health. I think you do a universal screening, period. I think you do it for, and we do it for bio, psycho, and social. So, I mean, that's a Cadillac version, but we think our kids are deserving of Cadillacs, but, we understand resource allocations, but we don't care. We think our kids are deserving of Cadillacs.
Right. Okay. Keith Hunt.
Yeah, very quickly, Horace, and the conversation last time, I'm just trying to pick up a couple of points, particularly your sub-bullet there about decriminalizing. And I have to ask this, generally speaking to you, is within this package, it seems there's another layer to the school-based wellness center model, and that is one, to decriminalize behavior, but that would be kind of a law enforcement element. My mind says that within school districts, school systems, there is school-based policy, maybe school by district, but school-based policy around disciplinary actions. And should we have a bullet there that talks about changing, adjusting school-based policies to take into account, be more trauma-informed or be updated to be more trauma-informed? I'm not saying this clearly enough, but somewhere bottom line is not only in the criminal justice system, but also within the school policies around disciplinary action, because that's where the criminalization process starts, because the policy says we have to take certain actions, and then do they take into account within their policy trauma-informed approach with it? Because the next step then is when they take the disciplinary actions within their policy guidelines, then it becomes a criminal act that goes to the criminal justice system when the school resource officer jumps into the fight.
No, you saying, Keith, you saying, well, I don't know about other people, but I heard it clear to me. You're actually right on point, I believe. And let me also say that the Department of Education really, under what I have been experienced, really by, I think, Terry Lawler, really has been pushing this. And I think that there's a whole bunch of effort around doing exactly what you're talking about, Keith, really putting in trauma-informed practices, restorative justice practices, these things that we need to put in place so that we can identify what we really have versus, and a policy around it, versus disciplining these kids for physical, emotional, mental, and social concerns. Not to mention, by the way, the disparity in discipline. Even that is an issue. But right now we're just talking about just removing the interpretation or the policy that guides these kids into some kind of quote unquote problem discipline, which marches them into criminalized or designated criminalized. Because we got to understand that once kids get a peer representation of that, it's really hard to shake. And because it manufactures not only among their peers, but other teachers expect that, that when they see a child, they immediately go to that level of default. So I'm in agreement with you. There should be something else in there if you unpack it. I agree.
And let me just say, what comes to mind is this recent the racism impact across America is becoming too highly normalized. The wind is shifting too far to normalize that. An example I want to give is when a young man is out delivering FedEx packages, doing his job, and then people decide to cut him off, shoot him because he looks suspicious. And not only do that, they don't call the police, they actually shoot up his truck. Now, you would think that that would be cause for police to be called and get involved right away. It takes another week before the police to get involved in this. And then the charges are assault, not attempted murder, but just simple assault. Something is desperately wrong with our country when people that are Black and brown can get shot at, and evidence of being shot at. It takes a week to bring charges, and then the charges are weak. Something is wrong. So I'm saying we have to take responsibility to put these things in writing and hold them front and center, because there's unconscious bias. This is worse than unconscious to me. So I'm deeply concerned that we have to make sure that this gets put into policy statements in the school district, because I don't think that the evidence tells me that they're not conscious of this at all. So,
well, I have a different view of that. I don't believe it's unconscious bias. I think that's too low hanging of an issue. I think and I'm all for America, by the way. So I know when I talk, people might think I'm an anti-American, but I'm not. I'm anti-system of what has transpired. It is embedded into our society that it's a culture. And I know I'm affected by the culture as a Black man. I know that when I look out on in terms of how I look at Black males, I know my culture impacts how I look at Black males. I'm a Black male. I know that there is something in our culture. I don't really believe it's an anomaly. I don't. It's too historical. And I believe shining light where it needs to be shined. And I don't, and a pastor, and let me tell you something, just by me referencing this, I was early on in 2020, a Black pastor got a group of pastors together around these issues, George Floyd and so forth. And a white pastor said this is not an anomaly of the system. The system is working perfectly. The difference is that we need to understand that and go about the business of uprooting that, not dealing with things that we cover up with unconscious bias and all of that. And because there's no unconscious bias, people know they're just not truthful. So there are people who know. People know these things exist. They're not truthful. And that's why we can continuously have these things. We need to, And then, you can, one of my last thing that says this, integrate communities of color history in American and world history. Now, that's a lightning rod. They've, people have taken over that, call it critical race theory. They got laws against it and all this crap. So, this is a concern. And all because we don't want white folk to feel bad about history. Well, every time they talk about slavery, what you think I feel about it? I feel bad about what it does to me as a Black man, knowing that 400 years of this crap we're still enduring. I feel bad about that. Who gives a damn about how I feel? We still talk about it, limited, not the fullness of it, but we talk about it. The reality is that we need to talk about it, elsewise we're going to be doomed to repeat it. I have too much heart and hope for our country. I will fight to my last breath to get a full, equitable country where I know we can't march into any century or any new future with this crap. We can't, but we got folk who want to do it. So I'm going to, and I don't want to water down nothing, because watering down crap is what we've been doing. We need to just hold it strong and do it. And I don't care what happened. Let the folk have a heart attack or whatever. Maybe they need to go and meet their maker. We need to change this for our children.
Well, I certainly support everything you just said, and I would just again go back to the policy, and if there's another sub-bullet that we can put in regarding school-based policy being examined. I don't know how you put it, as far as you're better at that than me. That includes trauma-informed changes in the policies, because that's where the interaction first starts, around their policies, engaging with kids, and then we know there's disparity in that policy being applied towards Black and brown kids versus others who get a much more balanced approach. So
I think you framed it just right. Just do that. Let's do that. What you just said is good enough. Institute school-based policy that, and then there's a lot of buzzwords that we use now. Trauma-informed practices, restorative justice, there's a bunch of them. We can just use all of them and institute it.
Okay. Before I move on to the next, to Colleen and Cassandra, I just want to try to understand what the recommendation is stating. Somebody, Keith or Forrest, read to me what this, or tell me what this recommendation should say.
Well, second bullet to me is a whole bunch of things, so I want to unpack. The first one is that every school should include elementary and middle school should have a school-based wellness center.
With a universal screening model, correct?
Yes.
Okay. Second bullet, that is the one that we're discussing now, correct?
Yeah.
Well, we're saying keep the second bullet as a sub to that conversation, but also add an additional bullet that speaks to the school system's disciplinary policy. Yes.
Mm-hmm. All right. What should I write here?
Well, I guess a starter could be just put simply, and then I got Forrest can edit it because he knows all the stuff to put in there. But change, adjust, update school disciplinary policies to reflect trauma-informed approach, or something. And then Forrest just said, he's got a lot of stuff he can put into that, restating that appropriately.
Okay.
Yeah, I would just say trauma-informed, the other remediations, trauma such as trauma-informed restorative justice. There's a lot of them that address issues before we discipline
Right.
and imprison.
Right. Exactly.
Whatever that is, put that in there.
Right.
Okay. All right, Colleen?
I actually just raised my hand because I was trying to give some words to what you guys are describing around trying to help support children. I think one of the things that tends to happen in our schools is we hire retired police officers, and their focus is on sort of law enforcement, which is, not always conducive to helping children to sort of de-escalate and handle very, very difficult situations. So I just wanted to sort of add that, I think a social work component to some of the training and again, sort of that trauma-informed approach. That's all I was trying to just sort of add in there.
It's
important. That's a good point. Yeah.
That's an important point.
Yeah.
And our Life Health Center is operating around 3 prongs: physical health, mental and behavior health, and social health. And if we don't do those 3 together, we're missing the boat, because to your point, the social component is equally important. I don't think one outweighs the other. I just think they're all equal, in my view.
I would edit that statement as we're drafting this, because we look at this draft, including a social work component versus a policing component.
Yeah.
I mean, as you're doing that, I want to make a comment as I look at your son, Zachariah, and I hear all the promise in his voice and in his schooling. And my biggest concern is that this country is going to get into his way. Now that's a shame that I got to be worried. Now, he's not even my son, but I'm worried about the country getting in his way, to life, liberty, and the pursuit of happiness. That's ridiculous.
It's already started, Keith. They have a doll experiment, brown doll, white doll experiment, and you can now get on the internet and see that, as early as 5 or 6, Black and brown kids are dischoosing Black and brown as a favorable attribute and characteristics, and pro-choosing Caucasian as. So it's already started. The introduction is swift, it's complete, it's early. And it is detrimental, and it's killing our nation. And I'm sounding the alarm. It's killing our nation. And it's a mental health crisis. And it's not just killing Black and brown people because they just the obvious one. It's killing Caucasian people. It's killing Asian people. It's killing us.
Well, anytime you got Caucasian people just jumping in their truck and shooting at a guy because they think he's suspicious, if that's not a mental health issue, I don't know what is.
Right. D.L. Hughley said the worst place to be in America is the imagination of a white person with a gun.
Mm-hmm. All right, I am going to move forward because it's 6:30. Cassandra, and then Carmen, and then Debbie Harrington.
I think Keith and Forrest kind of covered it, but when Forrest was talking, I just wanted to echo and just make sure that this subcommittee is aware that this particular recommendation around school-based discipline policy being looked at and being altered to be more trauma-informed and to include more restorative justice practice and to include screening for behavioral health versus digging deep into disciplinary action. is actually part of some of the recommendations that came out of that gun violence assessment that Forrest was mentioning, that Hanifa Shabazz had commissioned when she was city council chair. Because in that data, what they found for those who are perpetrators of gun violence, they looked all the way back to their records starting at kindergarten. And they found that those folks who grew up to be gun violence perpetrators have very, very, very long histories of discipline, starting all the way from kindergarten all the way up. And so what came out of that is that an identification of whatever is considered to be a disciplinary challenge in those schools should be an opportunity for early intervention and screening, right? And trauma-informed behavioral health assessment and follow-up instead of continued disciplinary action. So I just want to connect that dot that this is a recommendation that was already proposed like in 2016, and we're in 2022 and nothing has been done. So I just wanted to connect that dot. That is one of the recommendations that came out of that report.
Thank you.
Yeah, and I mean, like it's kind of, is this conscious competence or unconscious incompetence when you can have something talked about in 2016 and nothing has been done? I mean, something's wrong with the picture. Just like we're not stupid people running a stupid process. Some of this has got to be by design. I don't want to point a finger, but it just defies logic that this could continue in this kind of pattern of disparate treatment, disparate situations that go unattended to for so long. It just defies logic.
Agreed.
Yeah.
Carmen Jordan Cox.
I was just going to refer the subgroup to a publication from Pennsylvania ACLU called Beyond Zero Tolerance. And if you Google it, it'll come up. Beyond Zero Tolerance, Discipline and Policing in Pennsylvania Public Schools. And it has some, not only data, but recommendations. I know about it because my brother's a senior policy advisor for the ACLU in Pennsylvania, but it's something you might want to take a look at in terms of recommendations and maybe shaping some language. So that was all.
Thank you.
What was that title again, Carmen?
Beyond Zero Tolerance. ACLU PA.
Thank you for that. And let's see, Debbie Harrington. Oh, did you put your hand down?
I did. I put my hand down because it's a question I can look up myself. It was really about the capacity of the current wellness centers or the one that's in Colonial, what's in it and what capability do they have now in terms of, do they have psychologists, social workers, who's in those wellness centers? And then the language in the recommendation, it says every school, including elementary and middle school. So are you saying that we would not include high schools?
Okay.
Well, I'll just answer that one. That's because there's already legislation in the state of Delaware that mandates for there to be school-based wellness centers in every high school. And that's already taken care of. Yeah, there's legislation in the state that mandates. So it's elementary and middle that it is not.
So why don't we just say what K through 12? But just include all the years rather than.
Yeah, because it looks like the wording just looked to me like it was saying that it's not necessary for high school, but
just put the years we want covered.
Yeah, and even the wellness center, when you. I don't know what's in, I can't speak to what's in there right now. And so, does it have the capacity to do what we're asking it to do? What we're saying, what we're recommending now, even to do the screening. I asked that question because I know if you in the school, psychologists in the school are not psychologists, so and so you have, counselors are doing the screening for students. And so I just wondered what real capacity do we have in the Wellness Center? And do you want to take the opportunity here to say exactly what you're trying to get to in the wellness?
So I do think it's important to be very detailed and explicit in the language of the bill. For the sake of time, I'm going to say that, possibly, we can have a separate meeting where maybe Forrest can do a presentation with the subcommittee members to present on the Life Health Wellness Centers that you have done in Colonial and Christina school districts. And you can also show how a school that was achieving below average, once 1 year post a wellness center, the school was achieving above average in lesser disciplinary infractions. But I think we should save that for a later date because we have to get through these recommendations. We are still only on behavioral health and we only have a half hour left.
I'm going to be quiet.
Now that if you're quiet, I'm going to ask you, are you okay?
Okay. Well, I can talk on about anything got to do with health and education. I can talk about it. So
we know, and racism.
And racism too.
So I'm going to move on, but I think it would be great to host something where we could educate people on elementary wellness centers and the work that's being done already. I'm going to move on to Colleen.
I just wanted to sort of second your thoughts, Representative Minor-Brown, of being pretty detailed about the recommendations, just because I think, I don't know, but I would imagine that in 2016, if this is something that was already established, then somehow we missed the ball, and we should be very, very intentional about exactly what we want to sort of implement and the end result that we want to see, and try to really kind of hone in on that.
Yes, thank you. I agree. And Representative Johnson.
All right, thank you, Representative Minor-Brown. I was waiting patiently because, having the conversations is always important. At the same time, I realize we are crunched for time. And so I was going to propose the following. Since we have talked through this and we've gotten to a point we have good language, not sure if it's perfect because there may be some more tweaking, if we could move forward and vote on this particular recommendation, that we send it to the full task force. And then after we do that, I'll tell you all the next thing I think we ought to do. Okay?
That's a good idea. Why don't we go ahead and do a roll call on this recommendation here? And like I said, I skipped the first one because that's already drafted. And it's a bill that is in draft form, and all of us, I know Rep. Johnson and I have already signed on to it as sponsors. So you will be seeing this bill be worked through the General Assembly this session to make behavioral mental health part of prevention wellness exams. So like I said, Forrest, she spoke that up into existence.
Yes, she did.
So let's talk about this really quickly. We're going to do a roll call on this one here, that every school, including elementary and middle schools, and like Rep. Johnson said, we can tweak, we can add additional information later, but to just get this out of the subcommittee level and onto the African American Task Force level, and we can tweak it prior to going to the full body task force. Every school, including elementary and middle schools, should have a school-based wellness center, not just high-need schools. In addition, make the health delivery be a universal screening model, including physical, social, emotional, and behavioral health. So we do have to do a roll call vote. Chelsea, could you pull up the PowerPoint?
I actually had my hand up.
I'm sorry, yes.
Personally, I'm comfortable. I like to see the final language before I actually vote. That's just kind of who I am. Is there a reason we need to do this at this meeting rather than the next meeting? Since we
Yes, because we have 2 meetings left, and that is it. We have to do it in this meeting. I'm sorry, Ms. Carmen, I love you to death, but if you want to abstain, you can abstain. We have to move forward, and we can tweak it over the next few weeks with Forrest before it goes to the full body task force. But the overall goal is to ensure that every school has a wellness center, because right now they don't. But yes, we do have to move forward with the vote. Debbie Harrington.
So I was just going to ask, so the next meeting, so next month, March, so we don't have the March meeting?
We do have the March meeting, and we still have your recommendations, and we still have the group's recommendations. So yes, we have to vote today. I'm going to do a roll call right now on this recommendation because we have to keep moving. We have spent an hour and we have only gotten to the second recommendation. We have to keep going. If we want to tie this up before the full body task force, which will be the last African-American. When is the last meeting, Rep. Johnson? Is it April?
April the 11th is the last meeting.
That's the last task force meeting, and we have work to do. It is crunch time for real.
Add to that, we are not the only subcommittee that will be trying to get our recommendations in front of them. So like when I, said earlier, like our timing right now, we have to move forward. I certainly understand, the desire to want to see all of the words in advance. I get that. To that, I would offer the spirit of this conversation and what we see in front of us is what ultimately would be put forth. What we could do is as soon as, Forrest and others, perfect the words, send them back out for people to look at them. But we have to be poised and ready to get whatever it is we get out of this task force meeting this subcommittee meeting tonight needs to go to the full body in February.
Yeah, I might just say that.
Now, or is it March? When is the full? I'm sorry.
I was just going to say, and I would support our two co-chairs in this processing. And let's, I'm prepared to adopt the 80-20 rule. We don't need to have the 110% correct language. But if the presentation is enough to lay out the intent, then we can deal with the 20% detail later. But I'm good with moving forward with it.
Thank you, Keith.
I do want to, Chelsea, I do want to just have Ray Avery marked present. Welcome. Thanks for joining us. And we are going to go through this roll call to vote on that recommendation for wellness centers in every school. Representative Melissa Minor Brown, I'm voting yes. Representative Kendra Johnson.
Voting yes.
Ray Jones Avery.
Yes.
Dr. Carmen Jordan Cox.
Yes.
Dr. Eleanor Kiesel. Simone Philpotts. Dr. Debbie Harrington.
Yes.
Cassandra Coates Johnson.
Because I'm representing DHSS, I have to abstain.
Forrest Watson.
Yes.
Keith Hunt.
Yes.
Dr. Nikisha Williams Bailey. State Treasurer Colleen Davis.
Yes.
State Auditor Kathy McGinnis. Lucretia Young. Okay, with that being said, I want to say we have 1, 2, 3, 4, 5, 6, 7, 8 yes votes, 1 abstain, and I believe that means that this the vote moves on to the full body task force. Okay.
All righty. Rep. Minor Brown, if you, I'm sorry, Chelsea, if you would allow Rep. Minor Brown to share her doc again so that we can go back. And I will
find it. Here it is.
Okay. Take your time. Propose what we ought to do for this, the next one. So, our time runs out at 7:30, correct?
Yes.
Okay. So let me bring this to your attention. We've just spent about 40 minutes talking through one particular recommendation and trying to work to get the language right. What I propose as we move forward with these recommendations is that, Forrest, in your heart of hearts, considering we're only going to push for 2 at this time, what is the other recommendation of this collection that you have here that is in your heart and soul and it needs to get pushed forward? Tell us what that one is.
I thought you was going to ask that.
So if I could just mention, Forrest, with the understanding that these will not disappear.
Absolutely. Just so that, because what we can't do tonight is we can't talk through every last one of them again. We have to get to the point of identifying what that second one is, voting on whether, working out some language if we can, and voting so that we know we now have those 2 poised to be in front of the full body task force.
I am wow.
Sorry, Forrest.
I'm narrowing it down to 2, and I'm suffering with those 2, although they all equal. I see, and I don't know how to do this, but restricting mental health diagnosis for children under 12. I've seen the damage that's done and continue to do with excessive ADD and ADD diagnosis and all the bipolar and all that stuff that is really rooted in trauma and mental and social conditions. And they follow our kids. It's very difficult. That one. I'm also looking at eliminating restriction and limitation on the number of mental health visits per year. That's an insurance thing. I don't know how much you can impact on that because many of the insurance companies that are covering us are self-funded plans exempted from state law. It's really got to go to the feds. And they've got to deal with it that way because, when self-funded plans, they are exempted from state law insurance regulations. So big insurance like state government, Christiana Care, and the county government, all them folk, you can't mandate that they do it. So, then again we got a lot of pre-trials, I don't know.
First, let me jump in here. Let me ask you a question real quick. The restrict mental health diagnosis for children under 12 years, would that fit under the blanket that we were talking about in the aforementioned one as one of the other bullets under the wellness thing? Would that fit under there?
Yeah,
okay.
That would.
Then let's fit that under there and then go to your other one around the eliminate restrictions for mental health visits per year. That at least puts us on a path of people being able to afford to get care without having it being cut off.
Yeah, absolutely. Thank you, Keith. That certainly will help our Medicaid population because right now in Medicaid, unless they changed it, at least my knowledge is that you only had so many, for adults, you only had so many outpatient mental health visits. And when you ran out of that, they took them from your inpatient benefit. Which, now you got to make a choice. So I don't, it may change it now because there are a lot of individuals, that are there are people of color that are, with mental health issues now due to, what's the name of that drug? Heroin and fentanyl and all those things that's impacting the Caucasian male community. So this might change as a result of that, because a lot of that changes. When that crowd gets impacted, all this crap changes. So everything, when that crowd gets it. And so right now that crowd's got it. So it's unfortunately, it's not unfortunate. And so it might change. I don't know. But I like what you did, Keith. That was brilliant. That helped me.
No worries. I say go with your gut, which was your second bullet, eliminate restrictions, then as the second item.
Yeah, I think I'd like to see that eliminated. I don't think you need the cap that. It's just not. It's ridiculous.
Okay.
Okay.
Rep. Minor Brown, can you put that identify, eliminate restrictions as the second one underneath the first, please?
Yep.
Thank you. Ray Avery, I see you. We're going to get to you in a minute, okay?
No, don't put it there.
No, it doesn't go there. It goes.
It goes
Let me not mess that up. Hold on a minute.
Yeah, it goes underneath. Sorry. Okay, now hit space. And there you go, right there.
There we go.
All right.
All right, so we need to have a vote on eliminating or removing a cap on the number of mental health visits or limitations on the number of mental health visits per year.
And you know what? 1 second, Rep. Minor Brown. Let's do that in a minute because I told Ray, I saw her hand up. I told her to her. So we'll go to Ray and then we'll go to a vote. Hi, Ray.
I don't even see her. Oh, there she is.
I see. Oh, there she is.
I'm here. Good evening, everyone. This may not be relevant at this point, but there are references to reimbursement or the lack thereof, just in terms of barriers. So I was just going to suggest that any recommendation that have a financial barrier to receiving services be bundled together.
Interesting.
That's good, Ray. That's good.
Mm-hmm.
I did have that as an issue too. You was asking me. I don't know. I think you're right. That is a barrier.
So just my assumption is that these recommendations get translated into either enforcement of existing policy or creation of new policy. Is that correct?
Yes.
So I was just trying to help to think of a way to not think of them as singular or standalones, because there are relationships to the recommendations. That was my comment.
How about something like eliminate barriers to receiving mental health services, and then put these other as sub bullets, whichever ones that relate to money. Have the overall recommendations to eliminate barriers to receiving mental health services.
Right.
I think that's good right there. I like that too. I like that.
Eliminate barriers to receiving mental health services.
And then have these all of the financial things as the sub bullets.
Exactly.
Right. Some of them are financial. Some of them are because universal screening isn't being done.
They're all barriers.
I'm just trying to think of a way to organize them so it doesn't seem like they're standalones. The other thing I was going to say around restorative justice and just disproportionality in school discipline, there's legislative action that was taken several years ago that hasn't been enforced around transparency and reporting, required training, and so on and so forth. And so it may be a good due diligence to have your staff, once these recommendations are voted on, to have the staff research to see if in fact there's laws on the books that are not being followed in practice. That's it for me.
All right. So Carmen, thank you for the statement, eliminate barriers to receiving mental health services. Then Mimi added such as, and then we have underneath it the restrictions, limitations, and then I imagine what we could do, or what Forrest could do, is go back through his list to identify those other things that are related to the fiscal constraints and other barriers to have as subcategories under here to show the scope of what the barriers look like.
Yeah.
And along that spirit, he could also include the criminal justice one, diversion one he had at below this at the bottom.
Okay, you got that right, Minor Brain?
I am looking for, where do you see?
Have pre-trial physical, mental, social assessment with diversion programs. That could be another bullet under sub-bullet under there. And you could even take pay for prevention exams. I mean, the blanket eliminate barriers helps us with capturing a lot of his sub-bullets there.
Yeah.
Mm-hmm.
You could take pay for prevention exams.
HRSA uninsured portal. Is that something we can do as a state, or is that a federal thing?
That's a federal thing.
Oh, okay.
It's something, but it's something that we use for COVID, and it really eliminates those barriers for people accessing COVID vaccinations and testing and related healthcare if they don't have any insurance, because the providers can get reimbursed through the HRSA uninsured portal. I think it's an excellent way that we could, we can start doing some things to reach the uninsured, but I know it has a financial tab with it. And,
well, the good thing is there is a bill that was just circulated that we all jumped on to provide insurance.
Message from Colonial School District. To hear the message now.
To provide insurance coverage to the uninsured. Oh, that's for actually, I think that's for undocumented. But I mean, there may be a way to still, and Cassandra and Colleen, you may have to weigh in on this, I'm not sure, but there may be a way to kind of mandate that providers or that somebody seeks that funding from HRSA to provide that, to be able to cover those exams for someone who is not insured.
Yeah, I think the other thing, again, I always think of ways to sort of try to implement some of these things. Like, as we're coming out of COVID, there are a number of challenges that individuals are facing. Mental health is a huge one. And I think that we can tie this ask back to the pandemic as well. Like, we've seen aggressive driving increase. We've seen increases in attempted suicide in our children, things like that sort of point to the need for mental health services, particularly for our most vulnerable populations. And so I think that's where I would start to look for some of that supportive funding.
And let me just say, while you're in the editing mode up there, your first bullet, restrictions, I think the word before restrictions should be remove restrictions.
Yeah.
Okay. So we do need to play around with this a little bit. We got the overall gist of it. Yeah. But we need to play around a little bit. It looks like Carmen's hand is up.
So, Rep. Minor Brown, after you hear from Carmen, I would suggest that we go ahead and vote on the very broad recommendation so that we can move forward, okay?
Yep, that's the plan.
And before you guys do that, can I add one more thing? You see where it says behavioral health assessment should be reimbursed along with physical health where appropriate? I think put that under there as well. And I'll tell you why that's different and why that is. Sometimes people have behavioral health issues that are not necessarily a diagnosed mental health conditions that impact on their physical health. And so, and so what happens is their reimbursement structure doesn't pay for that attention. And for behavioral, they want you to diagnose somebody with a mental health condition before you can do it. And so what either providers have to do is they have to search for something to diagnose somebody, or don't get paid and just try to provide the intervention. And so this is confusing. And so there is the healthcare system tried to do something with it, but they've kind of stalled with this. And we need to push this forward where behavioral health assessment should be reimbursed. There are conditions that happen that we behave in certain ways, or conditions in certain way that exasperate stuff. The most noticeable stuff is somebody is homeless is one. And that's a condition. It's not a mental health condition. I mean, it might be mental health that you're homeless, but the fact that you're homeless is not mental health, but it's a behavioral health issue or a social health issue, quote unquote, behavioral health issue that will impact on whether or not you may be having some kind of acute issue, or you might have something that is exasperating in your physical body. And if we can eliminate that, then we can be on the way of, but it falls under mental behavior health, but it's not quite, because you don't want to diagnose everybody with some kind of mental health condition. Does that make sense?
Sounds like my homeless guy with the long-term UTI that was untreated.
Yeah.
Sandra, you remember that?
Yeah.
All right, Harmon.
Yes, I was going to say, so you have parallel construction. Why don't you start it with reimburse behavioral health assessments along with physical health, and then you start all of them with verbs. Well, I don't know. We got to do reimburse behavioral health assessments along with. Then I got to work on the next one above that.
Yeah, I think that's good.
Okay, and then the one before. The one before should be ensure coverage for business.
I would say maybe utilized HRSA uninsured portal for reimbursement of prevention exams, including mental health. Does that sound right?
Yeah.
Got to get the parallel construction in there. Yep. I've been grading too many papers.
Is it preventative or prevention?
You can say either way.
All right, so we are going to vote on this, and then Rep. Johnson and I are going to meet with Forrest, and if others want to join, that's quite okay, to just kind of tee up some of this to make sure that it's prepared, it's ready to move on to the full body task force.
Do we have to vote on putting the last bullet under the first recommendation? Do we have to do that? You know, we remove restrict mental health and we put it under the recommendation we already voted on. Do we have to vote on that as well?
No.
No.
This is.
Didn't we add this bullet after we voted?
Yeah, it was added after you voted, but we voted up with the understanding that it was 80-20 already, so you probably don't have to vote on it again.
From a procedural standpoint, that's why I raised the question for the chairs. I have no opinion. I just raised the question for the chairs.
So
now I'm turning myself on mute.
I think for the first one, I think the overall recommendation is the wellness centers and the universal screening model. When we get into all of this here, we really need to talk about if that is this bill, if that is a separate bill, if there will be some language in this bill from this here. And that's something we need to discuss more thoroughly, and we can have the conversation outside of this meeting, and then we can come back. We can talk about it before the legislation is drafted. We can talk about it before the legislation is finalized and circulated. But I don't believe we need to vote on moving it up. Rep. Johnson?
I agree with you. And when I look at, these three sub bullets are just that. They are sub bullets. They all fall underneath this large category. And when we go before the full body task force, we're going to be talking about the very first bullet. That is what we're going to be presenting to them. Okay. Then when we get to the point of policies, legislation, this is where, I don't want the weeds. I don't have a better word at this point.
Yes, and that's when our fellows come in. That's when our policy experts jump in.
Exactly.
When we start putting language in the bill. This could end up being a 10-page bill.
Yes.
A lot more than just this,
Exactly. Yep. So we have to get that bullet passed first. If we try to do that bullet and these three sub bullets, it's not going down. So we just need to stick with this very high level. We know these other things are associated with it. If we need to provide examples for the full body task force when we're talking it through with them, we can do that.
All right, so we are going to vote on the recommendation to eliminate barriers to receiving mental health services, such as removing restrictions and limitations on the number of mental health visits per year, have pretrial physical, mental, social health assessments with diversion programs, utilize HRSA uninsured portal for preventative exams, including mental health, and reimburse and behavioral health assessments along with physical health where appropriate. So, and once again, like Rep. Johnson said, the main goal is to eliminate barriers to receiving mental health services, and we will get into the weeds eventually with all the extra. So Chelsea, if you could pull up the slide with the members. We're going to vote on this recommendation. Let me look. You may have already pulled it up. I may not. Let me see. Let me stop sharing.
Okay, I should be able to share it now. Can you see it?
Not yet. Yes. All right. Representative Minor Brown, yes. Representative Kendra Johnson.
Absolutely, yes.
Ray Jones Avery.
Yes.
Dr. Carmen Jordan Cox.
Yes.
Dr. Eleanor Kiesel. Simone Philpotts. Dr. Debbie Harrington.
Yes.
Cassandra Coates Johnson.
Yes.
Forrest Watson. Forrest Watson.
I was muted. Yes.
Keith Hunt.
Yes.
Dr. Nikisha Williams-Bailey. State Treasurer Colleen Davis.
Yes.
State Auditor Kathy McGinnis and Lucretia Young. So that is 9 yes votes. The motion stands. This recommendation will move forward to the full body task force. Okay. Now let's move on to the next slide. Or this slide. Okay. No, go back. I'm sorry. Yeah. All right. So we worked on 2 behavioral health recommendations.
Yeah.
We discussed training and education. Before we move on, Rep. Johnson, do you want to go back to physical and food and housing? We've got about
I want to go back to Dr. Debbie for training and education. Okay. So I know that she said she was going to take this time to start working through some things. Were you able to work through anything?
No. Well, we decided, Keith and I are going to talk after this.
That's right. You said that. I'm so sorry. I remember that. Okay.
Okay.
Yes. All right. So, what we have now is physical health, and we have food and housing. Food and housing has nothing at the moment to share with this group. What I will say is that it started as food and housing, and what I learned soon after, we actually had this research group, is that housing was also being addressed in another subcommittee. And with that, we took housing out of the focus, and food became our primary focus. We hope to have something for this body by next month. That's the hope. But if we don't, I hold on to knowing that ultimately, if we don't have something to put forth to the full body task force, what we do come up with ultimately will end up in the recommendations of the report findings. How about that? Okay. So just a brief update on what's happening with food and housing. Do we have anyone here this evening that's from the physical health group?
Yes, I am. And Eleanor and I want to say it was back in July, presented on some metrics to target.
Yeah. We're going to have to find that.
So one of the things that sort of came out of that is that, and I kind of would love to just sort of hear everyone's feedback. There were a number of sort of physical health targets that were specific. So it was things like hypertension, diabetes, things like that, that might be conversations that are very, very focused and detailed with a medical provider. And one of the things that we found and smoking was another one, mental health was huge, and sort of those discussions centered around suicidal ideation and suicidal attempts weren't happening. And so I'll just say this, that like there were several medical matrices that we could say that we're going to specifically target. But what I think, particularly inside of the medical community, the feedback that I'm hearing is that those, specific targets are actually changing a little bit, that hypertension and diabetes control has actually improved somewhat as, in a variety of, for a variety of reasons. But there are other things like physical trauma that has actually increased unexpectedly, and also some of the mental health. So I guess what I'm saying is that it sort of seems like today's healthcare metrics might be different from tomorrow's. And one of the things that was very effective in honing in on some of the more meaningful ways to combat structural racism, which I think is really the bottom line. And it's something that we've sort of talked about a few times. And the lighting is terrible in here. So I'm trying to light up my notes as I'm talking, as I wrote them down. So essentially, community power building organizations are, I think, a more effective way for us to engage on a grassroots level people that are within the community that really belong, partnering with their physicians and clinicians. And this has been done. So we looked at a few studies, but particularly out of the University of Southern California, their Equity Research Institute honed in on building community power as an antidote to health inequity. And there are a bunch of examples. One that I'll just kind of quickly, or a couple I'll go over really quickly, is in Kansas City, Missouri, they collaborated with communities creating opportunity and they set their own targets. And so one of the things that they did was they looked for increased funding for the uninsured. They wanted to remove mandatory disclosure of criminal history on job applications, provide paid parental leave, increase the number of banks providing reasonable small loans, and include life expectancy as a measure of success in the city's business plan, right? And so those were all things that they felt as though from a community perspective were going to impact health and wellness. And then there are others. Oh, darn. Sorry, oh no. Getting phone calls as we're talking. But one of the things that I think, so, and again, going back to physical health, one of the things that came out of Alameda County, California was a collaboration of Causa Justa, which was a just cause, and other community power building organizations, where they collectively got together and said they wanted to cap rent increase, affordable housing bonds, creating affordable housing bonds, focusing on proactive code enforcement of inspections to address some of the health-related housing complaints, and things like that. And so, because again, I think that what ends up happening is we have very unique communities that we're trying to sort of work and support. And we could go back to those matrices again and sort of pull those out and get very specific about them. But I think even in the last year, we've seen them change. And so I just want to get everyone's feedback on, I think that it's important that, that we're sort of engaging the community. And that's one of the ways that we help to sort of break down some of those barriers to connect with people on a more realistic level, to get a lot of that feedback. Because like I said, we could talk to people about their hypertension and say, we want physicians and clinics to, improve access to healthy food. And that's where, we're sort of going to target some of the hypertensive population or the diabetic population. But I think it also requires that real and true engagement from the community. But again, I'm open to the feedback.
So, Colleen, I'm processing everything that you said, and so then, if I thought about everything you said in terms of recommendations, some of the things that I heard is, where are my notes? I'm sorry. How metrics have changed, right? And that those things are going to continue to change. Whereas you thought that, early on it was high blood pressure and diabetes were number one concerns, but we're actually looking a little bit better in that area. And instead of, and this is my word, you'll have to help me out, instead of saying, we need to have some programs that are going to address these things, what I thought I heard you saying is that we need to have programs that will empower partnerships with the communities so that they can drive what is important to them.
Yeah, very consistent with the concept of a medical home model, where you're sort of empowering people to, to create the change that makes the most sense. And again, sort of the opportunity to have a platform to engage.
So, Colleen, what does that, if you were to put forth a recommendation, talk to me, what do those words look like or sound like?
Yeah, well, and I also invite, again, continued feedback on this one, because I realize I'm sort of left field, because the last time we spoke, we pulled up some very specific medical targets, clinical targets.
Sorry, I don't want to
Cassandra. Go ahead.
Yeah, Colleen, I didn't want to cut you off, but I did just want to jump in here before you start formulating the language, because I just want to make sure that I share from a public health perspective, the data that we look at consistently around hypertension, diabetes, things like smoking rates, show that in Delaware, we really aren't getting better. Right. And in particular, for something like diabetes in particular, our pre-diabetic rates are actually rising, and are actually rising among younger populations, and getting worse among special populations such as Black men and Latinx women. So, but one of the things that we also look at as kind of like a precursor or kind of a pre-marker for those metrics that you talked about related to hypertension, diabetes, those things are overweight and obesity. And so the governor has had an initiative that the Delaware Cancer Consortium has been a part of and championing over the last several years through one of the subcommittees around how do we address overweight and obesity in our state, because it is kind of the precursor, right, to someone becoming hypertensive or becoming diabetic, and along those lines. And our obesity rates have steadily increased, and they're almost as high as they've ever been, based on the latest data that we have from 2 years ago. So there are things in that space. So if you're thinking about a metric, one like really big metric to look at is how do we work together as a state, right, to address overweight and obesity. And that also goes into physical health with the issues related to physical activity. There are issues with access to physical activity, specifically among Black girls in Delaware. That data came out in the research project that Ray Avery and team championed through the National Coalition of 100 Black Women. There are other populations in Delaware that have challenges related to access to physical activity. Some of that, right, is due to a number of different issues, but safety is a part of that, right? Having safe spaces to actually be physically active, and also having, the opportunities and the supports to, be able to address some of those things. So like some of those are like the strings that tie together. So I just wanted to make sure that I kind of said that from a public health perspective. And we have this data available. Like you can look at some of this data on our My Healthy Community data portal, because we track those things and try to track them on a regular basis. But if you wanted an overarching metric, overweight and obesity may be a good one, and then tie that to what can happen at the community level to support improvements in those areas, and then the connection that the medical community may need to have in that.
I think, I will say that I think that that's a really meaningful way to sort of target some of these. I guess my question is, because I do think about, it's very different to target, anyone who's inside of school, so if we're talking K through 12, basically, and I think that I know that some of those, the pre-diabetic and obesity challenges we are facing in younger and younger populations. And so I'm wondering if we consider targeting the populations differently, or because again, I think you're right. Like one issue is a safe space. I think that's shared among children and adults, but particularly, school-age children who might come home from school and are following the rules that mom and dad set, or whomever has said you've got to stay inside until an adult is home, or those kinds of things. And so you can't expect them, if they go outside and a neighbor sees them, they may get in trouble, that kind of thing. So So yeah, I mean, what are your thoughts on that type of a target? If we sort of hone in on obesity and activity, and are we being redundant because of some of the things that we already see our governor doing?
Well, let me jump in on that. I think Cassandra kind of opened the door for reframing of this as we were trying to reframe horses. In that, and I don't know the right language, but could be the umbrella would be counteract. I don't know the right words, but just phrase it out. Counteract overweight, the upward trends of overweight and obesity rates in the state, or something like that. Then bullets under that would be to include safe places for recreational safe places. Could be going back to your initial premise here around food, access to healthy foods, choices, and you could build a number of bullets underneath that. But even if this framing interacts with the governors, it won't hurt. Because I mean, it won't hurt. I was supported actually. So I don't know.
Well, and just a question, just kind of around, and I think that's good. That's good feedback, because I think you're right. It doesn't necessarily compete, but just sort of back to the concept of if our target is going to be sort of honing in on the obesity, are we still sort of saying we want community engagement in that process? Because I do think that each community is going to look a little bit different. Like, and do we talk about funding some of the after school programs like the Boys and Girls Club, which I know has seen membership declining, and that type of stuff. I mean, you used to be able to show up and play basketball at a safe space at the Boys and Girls Club, and I know that that's dropping off.
Well, just to add to that, if you look at your original bullet point, and then some of the subs underneath that, the rent increase, affordable housing, code enforcement, inspections, those I think one of our co-chairs said that there is a housing subcommittee, that those things would probably fit under their conversation. So I think building out this one this way probably fits the charter, and it kind of helps with us putting something on the table that can really have some teeth in terms of health and welfare.
I agree with that. And I just wanted to add, we normally, I framed it as obesity, overweight and obesity, so that everybody gets it. But when we talk about it, we try to be asset frame it. So it's really about encouraging and supporting a healthy weight. So I just want to say that instead of I'm talking about it in the negative, we try to use the asset-based framing about supporting a healthy weight. To your question, Colleen, the National Coalition of 100 Black Women, the research report that was just published, there's a health focus one. And under the health focus one, there are, all 5 of the reports are really good. But under the health focus one of the things in talking to Black girls in Delaware, asking about physical health, healthy eating and nutrition was a part of that research project. And some of the things that the girls actually said, and I don't have the report in front of me, I don't know if Ray is still on here to help me with the language of what one of the recommendations were that came out of the report. But one of the recommendations was, partnerships, in the community that help to increase culturally competent, and safe access to different types of activities that support both physical health and emotional health. So, you mentioned Boys and Girls Clubs, access to that, but there are other activities like yoga and dance and art and things that help to, improve youth mental and emotional, and also their physical health, and that there is a gap, in the plethora or the amount of opportunities that are available either at low cost or no cost, right, to the population of youth that are most at risk across the state. And so, and some of that, so you might want to look at that health brief, because some of that language may already be framed in there that's with the cultural angle that we're looking at tied to addressing the disparities that we're talking about.
I'm pulling it up right now. Yeah, I again, like, I think that we put a lot of research into some of the health targets that we had originally presented. I guess my question was also, you know, I'm going to pull up the brief, but I'm wondering if, as an overarching, you know, I think we had pulled out like maybe 3 or 5 metrics that, again, I think in some ways, you know, have changed. But if our purpose is to kind of like pull out very specific, and again, I think we should be specific about what we're trying to achieve. I can go back and sort of look at what those original recommendations were that we had back in July. Again, I don't know why I can't access it on the drive any longer, but if, I don't know if you guys are able to circulate it again, but I guess, I still sort of think that as we kind of move forward, a big part of this really and truly has to be that community involvement and really empowering folks inside the community to kind of step forward and be part of that engagement. Because I think, to your point, the variety of accessible, safe modes of remaining active are going to be a little bit different, and we'll need some of that feedback and that engagement.
But also, in the education and training, we talked about community partnerships also, and maybe an overarching recommendation is about community partnerships. And then that metrics portion that you're talking about could very easily come under that, in terms of, so we, you build these partnerships and we get metrics, and we get cultural competence, and we get, just training and education. So maybe maybe the community partnership is an overarching recommendation, and we can put some of these things under that one.
Well, Debbie, I was going to say that to that point, it could still fit under this umbrella if we want to try to get something that we can vote on tonight. I know time is tight, but if I look at encourage, support healthy weight in our state as the blanket, and then the bullets, I would say provide access to healthy food choices, create safe and welcoming spaces for exercise and play. And then the third bullet would be create safe and welcoming spaces for exercise and play. Create safe and welcoming spaces for exercise and welcoming. Safe and welcoming. There's a difference. And welcoming spaces for exercise and play. And then the last one, to piggyback on your comment and the conversation, would be I don't know, integrate community partnerships in, I don't know the right words, in the two above. Because one of the
incentives to some of these community organizations to have, so that they can have the funds, to create these.
That's even better. Provide incentives. Yes. Mm-hmm. Yes. And while you're writing that, this links back to the conversation we had with our last presenter in last meeting in terms of the community involvement around the access to healthy food choices. And the second bullet makes me think about all of the development work that's going to be taking place. And when I read about that, I wonder, what's the policing going to be once those developments occur? Are they going to be policing populations to keep them out and away out of unconscious bias concerns? Or are they going to be policing in a way to help ensure that those folks feel welcome and have access to those spaces for exercise and play as well?
Yep.
Because if you think the boogeyman lives next door to those development spaces, then you're going to be police to keep them out.
Yeah.
I add additional funding or increased funding or some type of something here.
Yeah, that looks good. Provide incentives and funding to community safe spaces to prevent, like, I'm sorry, I'm like, let's get into all the details to prevent racial bias in creating, like, in public safety.
I like that.
Like,
That's good. Yeah.
What's the overarching one? I can't read it. I'm sorry. I'm trying to. What do you think?
The overarching is encourage and support healthy weight in our state.
Yeah. Okay. Yeah. Thank you. Yep.
And that statement alone sets us on a great, tremendous trail in terms of tackling, as we were pointing out, pre-diabetes trends going upward and diabetes trends going upward. And that language, healthy weight language, helps the conversation be heard.
Yeah, I agree. You know, there was some legislation that passed. I want to say it may have been in California. I'm not sure. I feel like this is something that Carmen might know the answer to. But I was looking into it for Delaware, and maybe it'll fall under Forrest's bill. I don't know. But it had to do with allowing our providers, mental health providers, and primary care providers to prescribe exercise and yoga and different types of activities basically to prescribe those activities, and then it would be covered under your health insurance coverage. So if it's not, I mean, you can join a gym if you're pre-diabetic, but you got to be pre-diabetic to join the gym and get it covered under your health insurance.
It does sound like California, but I don't know if it was. But that doesn't what happened in California.
Right. This was more like a preventative way. Like, I can literally get a script for my child to take ballet lessons and it will be covered under my health insurance, you know, but that would be for her a preventative way of, you know, increasing weight. So I don't know, just something to think about.
Hey guys, I think we have a real good model to address this. And we can start by looking at our ability to affect infant mortality in the state of Delaware. And what we have found, and this is one of the things that I kind of was trying not to talk too much, but I have to interject here, is that if we were to take educated Black women that live out in Hockessin, Centerville, eat the right stuff, do all of that, they have worse infant mortality statistics as a white female who don't complete high school and dropped out of and live in a trailer park. Live in a trailer park. So while I do support community engagement and empowerment, what about those Black women that have empowered, who are at the highest level of their educational experience, live in quote unquote safe environments? How come they don't have positive infant mortality statistics? If that was the answer, 'cause it ain't. Okay, it ain't. It's a part, but it ain't the answer. Notice THE, definite article. It is not. I think this stuff, and we make this meaning, and I understand what, community power, building organization, building community. That reeks of blame the person. That's what it reeks of to me. It's like a person can decide if they don't have a grocery store in walking distance that sells affordable vegetables. Okay.
Well,
You're absolutely right, Forrest.
This list.
Can I jump in for a second, guys?
Kate, hold on. Kate, my name is Forrest. Forrest. Forrest.
I have a question. Are we prepared to vote on this?
I don't think so, because I think we could take some measurements and some success from what we do. I'm over here at the Infant Mortality Consortium, and we are wringing our fingers and all of these things we done tried. It don't work. You know what we come back to? We got a racist system, but we just back up and play like we ain't said it. That's the problem. Segregation, racism, microaggressions. If we don't get to that, it doesn't matter what we do. I'm going to tell you, we can do that all in blue in our face, or brown or dark or whatever color. You're not going to make an impact. I did like life expectancy as a trail. I like that because it put some meaning behind some outcomes. But I don't like all this other stuff because it reeks of what I hear of certain political talking points for why folk in communities and darker communities keep having these bad outcomes, because it's their fault.
So let me jump in quickly. I hear you, Forrest. You're on a roll. I was asking if we were going to be voting on this as a recommendation, because I need to excuse myself to go pick my daughter up from school. So then if is the consensus that we are not voting on this encourage, support healthy weight, and then the 3 categories under it?
Let's ask Colleen.
Okay.
What she would like to do. We can vote on this tonight, or I know you mentioned going back and talking to Eleanor, so it's up to you if you want to move forward with this recommendation tonight, or wait till.
Yeah. So some of the reason why I wanted to have this conversation is because, as I said, some of those things that we brought up in July feel stale. And again, I just wanted to kind of get everybody's feedback. I do think that it is important that some of what we do is very intentional. I think it's also, if you were to talk with a Black physician, as I've done, and a white physician, and you sort of outline what it's like to be standing in their shoes and what it's like, when you ask, what is it like to be that person, that patient that's being treated by those individuals? Their feedback is very different. And I think that it's extremely important that folks who have some of these biases are not identifying that they have them. And I do think that when you are faced with a person who is part of the community that you are treating medically, who says to you, this is ineffective. You talk to me about, going and getting a bike ride in. That's ineffective for some people and for some communities. It's ineffective when we talk to children who are aged 10 years old and we say to them, well, go to the playground and run around with your friends. And so I do think that I would stand behind empowering our communities to get involved in speaking with their clinicians and being part of that engagement. But again, I do think that some of these metrics I kind of have to look at them again. And like I said, I'm not sure why I don't have access to that original document. If there's any way that we can sort of circulate that, I'm fine with putting a pin in this and just sort of, getting additional feedback. But I speak from the perspective of a clinician who, a white clinician who has treated all different types of people, including folks in third world countries who do not have access to healthcare in the same way that we do. And I can tell you that, from that perspective, the problem is I, as a clinician, take with me my own experiences, and I can only empathize, and I can only tell you that my absolute intention has always been to treat people well. It hasn't been to be racist. And yet I have a cultural bias because I grew up in a different area without the threat of concerns of gun violence and, things like that. And so if I'm being completely honest, I do think that I need individuals to tell me what you're saying makes absolutely no sense for someone in my shoes. And so I'll just say that here I am coloring my perspective also in some of my response. So I recognize that, but I do think that there's a meaningful and intentional thought process that I've gone through, and I would say we put a pin in it and we can circle back to it. But I do appreciate everyone's feedback.
Wonderful.
Thank you for that.
I'm sorry.
Oh, sorry, Rep. Johnson.
I'm sorry. We're talking over it. So I'm going to go ahead and excuse myself so I can go pick up my daughter.
Okay. Have a good night.
Bye, everybody.
We're actually going to table this for now until the meeting. And we are going to, Chelsea, if you could pull up the PowerPoint because it is 7:45.
Yes.
And our meeting ended 15 minutes ago, but we always go over because this is a good group and we have great conversations. We are at the public comment portion, and I'm just going to look right now. We don't have any attendees still on for public comment. Chelsea, are you seeing the same thing?
Yes, I don't see anyone in the participants or waiting room.
Okay. All right, so we can move on to the next slide. Oh, wait, I'm sorry, go back. Public comments can also be emailed to African American Task Force at delaware.gov for those that are going to zoom in on the YouTube page. Okay, next slide, please. Closing comments. Are there any closing comments before we adjourn until our next meeting?
Yeah, I have one. I would be happy to sit down with Colleen Davis and share experiences. And I feel her, concern, and I would be happy to sit down and talk with her and to open up and talk about what it is we're facing. It's not for all those providers who are out there who are doing their very best. It's not an issue against that. It's not. It's more than that, and we need to address more than that. And when I make the comments that I make, I'm forcing us to address more than that. Unfortunately, it looks like I'm disparaging other people who are out there every day struggling to do their very best, and it's unfortunate. But I have this voice for a reason. So, Colleen, I'm open myself to talk with you and to sit down and hear your concerns and hear your position and talk and see if we can wait through, and I can give you the benefit of some of my healthcare experience that I've had for a number of years. It's not the complete universe, but I'm telling you, I've got some things that I think I can be useful.
Awesome. I appreciate that. I'd love to welcome it.
Okay. Thank you.
Thank you.
Good. All right, and I believe we already have our dates for the next meeting. Do we have another slide? I don't think so. But I was going to ask Carmen if she could pull out her handy dandy